The injectable drug semaglutide, also known as Ozempic, is used to treat type 2 diabetes in patients. If you also have heart disease, Ozempic can help you control your blood sugar and reduce your risk of a stroke or heart attack. It is also available as the oral medication Rybelsus. Also allowed to aid in weight loss is Wegovy, a stronger variation. Semaglutide functions by imitating a gastrointestinal hormone that triggers the release of insulin from your pancreas, prevents the release of sugar from your liver, and decreases the rate at which food leaves the digestive tract. These behaviors can help with type 2 diabetes and losing weight, but they can also have some unintended consequences. Some of the adverse effects of semaglutide might be uncomfortable and make the drug hard to take. The positive aspect of these issues is that they typically fade away with time. There are some severe adverse effects to be aware of, despite their rarity. Learn more about the adverse effects of semaglutide you should be aware of and how to treat them by watching the full video. Nausea and vomiting. Initially, nausea and vomiting appear. The most frequent side effect of semaglutide is nausea. In clinical trials, up to 20% of individuals using it for type 2 diabetes experience nausea. If you're using the higher dose version to lose weight, nausea is much more typical. Vomiting is generally less frequent than nausea. With higher semaglutide doses, these adverse effects are more likely to occur. To reduce these side effects, your healthcare practitioner will gradually increase your dose over a few weeks. Most people should experience a reduction in these adverse effects as their bodies adapt to the medicine. Semaglutide-related nausea and vomiting can be controlled by eating smaller meals more frequently, avoiding foods heavy in fat, and standing upright after eating. However, seek immediate medical assistance if these negative consequences are followed by excruciating stomach discomfort that may or may not radiate to your back. This might be an indication of pancreatic inflammation, a rare but serious adverse effect. Later, more on that. Chronic fatigue. In clinical trials, fatigue was a frequently occurring side effect of Wegovy, affecting 11% of patients. Less than 5% of Ozempic users felt fatigue, and Rybelsus users reported no fatigue at all. Semaglutide helps you feel less hungry, which aids with weight loss. Additionally, eating fewer calories could make you feel more exhausted. As your system adjusts to probable changes in diet, fatigue should lessen. Diarrhea. Another typical side effect of semaglutide is diarrhea. During clinical studies, approximately 9% of people taking it for diabetes, with type 2 and 30% of people taking it for losing weight experience diarrhea. With greater levels of semaglutide, diarrhea is more likely to occur, much like nausea and vomiting are more common. As previously discussed, your doctor will gradually increase your dosage over time to reduce this side effect. Although it might happen, constipation is less typical than diarrhea. Alterations in vision, diabetic retinopathy. Next is diabetic retinopathy. A dangerous eye condition called diabetic retinopathy can cause blindness. People who have type 2 diabetes and persistently elevated blood sugar levels are more vulnerable. Blood vessels deteriorate and bleed blood into the tissues that surround them in this type of retinopathy, causing inflammation. This causes the formation of new blood vessels over time, which clogs the optic nerve and can cause blindness. Diabetes for more than 5 years, poor glucose levels, high cholesterol levels, high blood pressure, pregnancy, kidney failure, cigarette smoking, cataract treatment, or other eye issues, and a family history of diabetic retinopathy are risk factors for establishing diabetic retinopathy. Rapid blood sugar control enhancement, which Ozempic may cause, has also been linked in some individuals to a brief exacerbation of diabetic retinopathy. In a clinical trial for Ozempic, more individuals receiving Ozempic 3% experienced problems from diabetic retinopathy than those getting a placebo 1.8%. Patients who had previously experienced diabetic retinopathy had a higher probability of developing the condition, Ozempic 8.2%, placebo 5.2%, than those who had no prior knowledge of the condition, 0.7%, placebo 0.4%. There hasn't been any research on how semaglutide's long-term management of blood sugar affects diabetic retinopathy problems. Thyroid cancer or tumors. A little gland called the thyroid can be discovered on the top of your neck. By producing and releasing specific thyroid hormones, your body can better regulate a variety of bodily processes. The danger of tumors of the thyroid or cancer of the thyroid, which has been observed in animal rat research, is one of the most severe but infrequent warnings associated with Ozempic. Although it is unknown whether Ozempic may result in thyroid tumors or cancer of the thyroid in people, the FDA's most prominent caution for this potential side effect is a boxed warning. If you have medullary thyroid carcinoma, MTC, a kind of thyroid cancer, or multiple endocrine neoplasia syndrome, kind 2, MEN2, two endocrine system conditions, you should not take Ozempic. Hair fall. Rapid weight loss may cause hair loss or shedding. This could be one of the factors causing some Wegovy or Ozempic users to have hair loss while receiving treatment. In the Wegovy clinical trials, this adverse effect was recorded by 3% of those taking the drug. Telogen effluvium, also known as hair loss, is typically transient. Hair loss brought on by Wegovy or Ozempic should stop when your body gets used to it. Remember that it can take several months. It's crucial to make sure you're receiving enough nutrients from protein, vitamins, and minerals because these drugs might potentially impair your desire for food. If you're not, this may also cause you to lose your hair. You can make sure you're receiving enough nourishment while undergoing treatment with the aid of your healthcare professional. Allergic responses. Semaglutide seldom causes severe reactions to allergies, but they can happen. If you experience face, spoken language, or throat swelling after taking your medication, along with shortness of breath, dial 911 or seek emergency medical assistance right away. Itching, irritation, or warmth at the point of injection are only a few examples of mild allergic responses. With mild responses, stopping semaglutide isn't usually essential. Nevertheless, be careful to inform your healthcare practitioner of your reaction. If any of their ingredients cause an adverse reaction in you, avoid using oral or injectable semaglutide. Additionally, if you've previously experienced an allergic response to a drug in the same class as semaglutide, you run the risk of experiencing one again. As you continue to use semaglutide, many of the above-mentioned adverse effects might become better on their own. Get in touch with your doctor if minor stomach-related side effects don't go away after a few weeks. At any moment, if they become severe, seek immediate medical assistance. This might be a precursor to a more serious issue. If left untreated, hypoglycemia can develop into a major problem that could result in hospitalizations, comas, or even death. It's critical to understand the symptoms and treatments for low blood sugar. If you notice that the levels of sugar in your blood are getting too low, speak with your doctor. The dosage of additional blood sugar-lowering drugs you're taking might need to be changed. Thank you for watching. If you liked the video, make sure to like and subscribe to the channel.